We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live. This is the show where we discuss the latest trending medical headlines and celebrity health news. I am Dr. Frita, and boy, do we have some medical topics for you. We are going to talk about the screwworm. What is a screwworm? Why is it here? Yes, it's a flesh-eating parasite. We'll get to that, so make sure you stay with me. I'll give you all the details you need to know. And of course, we're going to talk about Ebola. We are in a race to keep Ebola from coming to the United States. And you know, we have the World Cup coming. And so I'll talk to you about updates on Ebola, some good news, some not so good, but I'll let you know what you need to know as far as staying safe and being prepared. And then we'll talk about the beloved Peabo Bryson. You know Peabo Bryson with his melodies, his ballads, his duet. Oh my gosh. Can You Stop the Rain? Of course, his Disney hits, both of which won him Grammys. Beauty and the Beast, his duet with Celine Dion. A Whole New World, his duet with Regina Bell. Well, unfortunately, Peabo Bryson has passed away at the age of 75 from related complications, reportedly, to cardiac events. And he actually had 2 cardiac events. We'll get into that, and I'll let you know what you need to know. And then we'll get into my favorite game, myth versus fact. And we'll talk about Edward James Olmos, a well-known Mexican actor, producer, director. Well, he's coming to the front to talk about his battle with throat cancer. And so we'll have a myth versus fact segment where I'll share some information that will surprise you about throat cancer. Okay, so you don't want to miss that. And then we'll get into our second weekly dose of trending medical headlines and celebrity health news. And I'll talk to you about Queer Eye star Karamo. He was on the cover of People magazine. He's done just a really, really insightful interview. And he shares, among many things, that he had a botched plastic surgery. I'll talk to you about that plastic surgery and ways to at least try to prevent dealing with what he is now sharing that he has dealt with. And then we'll talk about President Joe Biden, because Dr. Jill Biden, our former first lady, shared that she thinks that he was diagnosed with prostate cancer too late. And so we'll talk about prostate cancer, which of course is the most common cancer among men, and what some recommendations might be in order to prevent prostate cancer from being diagnosed too late. And yes, again, we will definitely be talking about the screwworm. So get your pencils, get your paper.
Today, the World Health Organization said the fight against Ebola in the Democratic Republic of the Congo is, quote, catching up with the spread of the virus. But health officials warn the crisis is far from over. More than 340 cases have been confirmed, and the outbreak has crossed into neighboring Uganda, worsening the challenge of containing the deadly disease in a region already riddled with conflict, displacement, and strained healthcare systems. To get a view from the ground, we turn to special correspondent Chris Oshamringa in the DRC's capital, Kinshasa. And to give you a sense of the scale of the challenges moving about the DRC, Kinshasa is about 950 miles from the epicenter of the outbreak in the country's northeast. That's roughly the same distance between Jackson, Mississippi, and Washington, D.C. Chris, thank you for being with us. Bring us up to speed. What do we know about the scope of this outbreak right now and how concerned health officials are about it?
Well, health officials in the Democratic Republic of Congo are struggling to contain this outbreak that has spread rapidly since it was declared on May 15th. Back then, health officials told us that there were only 3 areas that registered cases: Rwampara, Mongwalu, and Bunia, the capital of North Ituri province in the northeast of the country. But now there are more than 20 health zones that have recorded cases. We've been told that there are 60 people who have died and 344 others were infected with this very contagious disease. Last week, many health facilities there were overwhelmed by the number of people.
Oh my goodness. Can you hear me?
Yes, I can hear you.
Okay, very good. All right. Sorry about that, Shador. Sorry, med heads. Yeah, it's Murphy's Law. I'm telling y'all, everything is going on. They're doing work outside of this building. Dogs are barking, like just everything is going on. And so I hope y'all heard everything we're going to talk about. Let's just get rolling. We're going to talk about Ebola. We're going to talk about the late Peabo Bryson, his 2 cardiac events. We're going to talk about myth versus fact and what you need to know about throat cancer. We're going to talk about Queer Eye for the straight guy Karamo and his botched plastic surgery. We'll talk about President Joe Biden and how his wife, Dr. Jill Biden, says that his prostate cancer was diagnosed too late. And we're definitely talking about the screw worm. Okay, so you just heard some of the updates on Ebola. It's still here. The outbreak is real. I want you to go in the chat, please, medheads. Give me a little green germ emoji as we get going on Ebola. And I want you to tell me, are you confident in what the United States is planning to do to keep Ebola out of the US? You know that the World Cup is coming. You know that we want to keep the United States government had planned to have a quarantine unit in Kenya. And we have certain, airports that are set up to keep Ebola out. Let me know if you're feeling pretty confident in what the U.S. is doing as far as keeping Ebola out of the U.S. And then I'll go ahead and talk, and you can put some questions in, and we'll keep it going. All right. So, Ebola. We know that we have the Bundibugyo strain, which is a rarer strain of Ebola. Typically, we have the Zaire strain as far as the outbreaks in the Democratic Republic of the Congo. And you will recall that the Democratic Republic of the Congo, of course, in Central Africa, is where we first saw the Ebola outbreak back in 1976. Since then, they have had 17 outbreaks and epidemics. Most of them have been with the Zaire strain. Now we have this Bundibugyo strain. This is only the 3rd one in the Democratic Republic of the Congo that is of the Bundibugyo strain. We have no vaccine for the Bundibugyo strain. We have no FDA-approved treatments for the Bundibugyo strain. Yet the numbers are going up, up, up. And I will say, you'll note that there has been an adjustment in the numbers recently, because before they were saying that there were 1,100 suspected cases and like over 300 deaths, all of these things. Now, according to the health ministries of the DRC, as well as of Uganda, they're saying that that was an overestimation. And a lot of people who were sick and who had fevers had different illnesses, malaria, for example. So now, according to the latest numbers from the Democratic Republic of Congo and Uganda health ministries, the Democratic Republic of the Congo, DRC, says that they have 452 confirmed cases of Ebola, 82 confirmed deaths. And according to Uganda, there are 19 confirmed cases and 2 confirmed deaths. And we have really good news that Dr. Peter Stafford, who was a surgeon over there with his family for missionary work, he contracted Ebola, you'll recall. And he was performing surgery on someone, taking care of a patient, and that patient subsequently died. And they didn't know, but they found out later, or now we believe that that patient had Ebola, hence giving the doctor Ebola. Well, he was transferred to Germany. He wasn't repatriated back to the United States. And it was stated because Germany was closer and we just felt like it was better and he didn't need to travel. Later, Secretary Marco Rubio just outright said the quiet part out loud. He said, we cannot and will not have Ebola in the United States. And that's why also we have planned to build a quarantine unit in Kenya with 50 beds to keep Ebola patients or people who were exposed to Ebola and who were United States citizens. At the time, the plan was just to keep our citizens there, U.S. citizens. Well, now the High Court in Kenya has halted that process because they feel like it's unconstitutional. And they also have 0 cases of Ebola in Kenya. And so some statements from their leaders are, hey, if Ebola is too dangerous for America, it's too dangerous for Kenya. Either way, with this first Ebola patient who was a United States citizen, Dr. Peter Stafford, he was sent to Germany on May 20th. And now, as of this weekend, he's been discharged. He has tested negative for Ebola. His family, including his wife, Dr. Rebecca Stafford, she's an OBGYN. She also has tested negative. She never tested positive. Their 4 children also never tested positive. So all of them have reportedly recovered from Ebola. So that's some good Ebola news we have. And now moving on to the rest of the Ebola news, we do have the World Cup coming soon, like really in 2 seconds, right here at a soccer field near you. And we will have patients or players from all over the world. We'll have spectators from all over the world, including the soccer team from the Democratic Republic of the Congo. Now, reportedly, the plan was for them first to go and be quarantined for 21 days, just those soccer players, and then they would be permitted to enter the United States. But also we have people like who's in control of who's traveling from here to there. How do we know that we don't have other people, not necessarily soccer players, who are in Uganda, South Sudan, Democratic Republic of the Congo? How do we know that they haven't made stops in England, Italy, Canada before they come here? Do you feel secure and safe in our plans to keep Ebola out of the United States. So I'll see what you say, MedHeads. And remember, we had the live Q&A right here on the Dr. Frita channel. So make sure you go there if you have questions about Ebola and this Bundibugyo strain. Plus, I've done multiple shorts, and you can find them right here on this YouTube channel or on my other social media platforms. Just follow me on all platforms at Dr.Frita. And I post different things in different places occasionally. You'll see when you go and you look. And so I thank you, bedheads, for hanging out with our technical difficulties. What say you? Are you feeling pretty good about our Ebola preparedness?
Well, Dr. Frita, the majority are saying no.
What?
Not feeling prepared. I remember Miss Sheila. She says, I still trust the process 100% of government doing its job here in America.
Okay. So you do trust it, Miss Sheila. Okay.
Mm-hmm. And so he did say why. He doesn't even no confidence in his news outlets. So no confidence, Dr. Frita.
No confidence. All right.
Yeah.
Well, I will say, I do believe that the transparency is limited, but reportedly, even though we no longer have USAID, which was the largest foreign aid agency in the world, and we're no longer involved in World Health Organization, I do want to at least share this about the Ebola and the Bundibugyo strain. It is a very deadly virus. That's the truth. And with this particular strain, the mortality rate is up to 50%, okay, 30 to 50%. That mortality rate also takes into account where the Ebola outbreak occurs. If it occurs in a place where there is limited healthcare, where there's limited antiviral medications, limited supportive care, then of course the mortality rate will be very high. But if you go back to 2014, at least with the Zaire strain, when we had it here in the United States, we had 11 patients recorded to have it here, and we only had 2 patients who passed away. And so when you're in a place with high supportive treatment, high medical technology, it does appear that the mortality rate is not as high. Not that we want to have Ebola here in the United States, but I do believe there would be a different picture if it did come. Also, even though the Ebola virus is very deadly, it is not highly contagious. It's not a respiratory virus that floats around the way that COVID does, or the way that the flu does, or even the measles. It needs to be you need close contact because it's with bodily fluids, blood, semen, vaginal fluids, amniotic fluids, breast milk, even in bowel movements. It's there. It's in bodily fluids. It requires close contact. Yes, it can live still on bedding, on clothing. And even if a person passes away from Ebola, they can still give it to you. You got to be close. Okay. So we're not talking about something that's going to be as communicable as something where you sneeze in the air. If that gives anyone any comfort at all. That being said, we'll still just continue to watch and see what the CDC is doing. And yes, over 2,600 employees who were scientists and vetted, they have been terminated with this current administration. That is true. And there have been multiple changes, including the head of our Health and Human Services being by RFK Jr., who's not a physician and who does not base a lot of his rhetoric in science. That's true as well. But big picture, let's just stay tuned. I'll definitely keep you updated. But at least now we know that some of the original numbers we thought from this Ebola outbreak, now they have shrunken, and that's good. And we know that the United States doctor who tested positive now has tested negative, his family as well. Reportedly, they're healthy. Make sure I did shorts on these Ebola outbreaks where I give them to you in a nice digestible way where you can share it. All right. So now that I think we're getting back. I mean, things are still going crazy. Thank y'all for hanging with me, MedHeads. And as you hang here, please still go ahead and give us a like and subscribe, because I am going to give you evidence-based medical information. I am going to let you know about these trending latest medical headlines, and I am going to give you the information on celebrity health news to help you. And for those of you who are new to us, hola, ¿cómo estás? I am Dr. Frita. I'm a medical doctor. I have been quadruple board certified. So I am a board certified nephrologist, meaning I'm a board certified kidney and high blood pressure doctor, which is going to be quite relevant as we get into our next topic on Peabo Bryson. I am a board certified internal medicine doctor. I am a board certified obesity medicine doctor. And after I completed my dual med-peds residency at Georgetown University Hospital School of Medicine, I earned my board certification in pediatrics. And so what does that mean? I like to learn. I love to learn. And more importantly, I like to share what I learned with you, which is what we do right here on this YouTube channel. Not only do we do it here for Medical Mondays, Dr. Frita Live, every Monday at noon Eastern Standard Time, I also give you short form content throughout the week. And I give you long form videos of evidence-based medical information. I talk about high blood pressure, heart disease, kidney disease, prostate cancer, breast cancer, cervical cancer, stress, exercise, you name it. I talk about it and I break it down in a way that's easy to understand and in a way that you can share it with your loved ones. So when they go to the doctor, they don't feel intimidated by the doctor. They don't feel like they're not being seen. And this is a way to help to close that health disparity gap. So if you are not subscribed, please do. If you are subscribed, thank you. Gracias. Muchas gracias. And make sure you give us a like. And I like to give you another thank you because here on the Dr. Frita channel, we are now up to over 1 million subscribers. And I could not be more grateful. And I appreciate all of you. And I appreciate my members as well. I know we got moving and we're going to keep moving, Shador. But if we can give a couple member shout outs. And if you remember who was here first to hang out with us, please go ahead and let the people know.
Absolutely, Dr. Frita. First in the chat is from Forever a King.
Hi, Forever a King.
Forever a King says, good morning. My name is Osei. For 2 weeks, I have been trying to join level 3 subscription to no avail. Please assist me when you have time.
Absolutely. So let's make a note of his name and then we'll make sure Osei.
Absolutely, Osei. And just very quickly, Dr. Frita, I can tell you if you're on her YouTube channel or her home page, next to subscribe should be a join button. If you click on join, it should show you the different levels. You just need to change your level to the chief med head. All right, shout out to members. Miss Rosalind is here.
Hi, Miss Rosalind. And thank y'all. I recognize y'all coming from week to week. And I appreciate y'all for being members as well and for wanting to be members. And don't sleep. I love all my med heads. All of y'all participate. I appreciate you. And when you give us a like, when you give us a subscribe, that's a free way to support the channel.
Absolutely. Hey, to Miss Sheila.
Hi, Miss Sheila.
Joining in, joyously hopeful as always. Hello.
Joyously hopeful. Thank you for being a member.
Miss Pauline, welcome to the show.
Hey, how you doing, Miss Pauline?
And hello to everyone.
Hello, hello. Thank y'all. I appreciate y'all for being here. And now, can we talk about Peabo Bryson? Y'all, that got me very much. It got me very much because we learned that he passed away. But even before his passing away, back in 2019, he had a heart attack. And then in 2025, he had a stroke. This really bothers me because we're talking about cardiovascular disease, the most common cause of death among everybody, men, women, everyone, especially, here in the United States. And largely, strokes and heart attacks are preventable, right? Not always, but most of the time they're preventable. And so we're going to talk about that and we're going to play a clip. But before we do, I want y'all to give me a heart emoji. And I want you to tell me, so I told you he had a stroke and he had a heart attack. Would you be able to know the difference between how someone's presenting, a stroke versus a heart attack? If so, please put it in the chat. How would you know the difference between a stroke and a heart attack? Either way, you need to call 911. Let's get that straight. But how would you know the difference between those symptoms? All right, let's play this clip and we'll talk some more about Peabo Bryson.
Hey, welcome back in. So Atlanta and the world is mourning the loss of a music legend. We are talking about two-time Grammy winner Peabo Bryson. He's died at the age of 75 years old after suffering a stroke.
Yeah, so beloved, so respected. Everybody knows his music. 11 Alive's race, culture, and religion reporter Danielle Nottingham sat down with members of his band. They looked back at one of R&B's most celebrated voices.
The world knew Peabo Bryson as the voice behind some of Disney's most beloved songs, but Atlanta claimed him as one of its own. Those who knew him best say he was one of the greatest artists who ever lived.
William Green and Regina Troop spent more than a decade touring the world with Peabo Bryson.
Tonight, I celebrate my love for you.
You cannot say as a person who likes music, you've never heard a Peabo Bryson song. You just can't say that. You may not know who the person was, but you've heard his voice.
Listen, y'all, I can sit here and listen to Peabo Bryson songs all day. And full disclosure, I have been. much to my children's chagrin, I have been singing songs. In fact, on one of my social media platforms, I didn't put it on this one. I actually shared what happened when I was singing a Peabo Bryson song. It's kind of crazy, but I really am a Peabo Bryson fan. And I do appreciate that his family has shared the cause of his death, because I do recognize, as we come here and we talk about celebrity health news, it's news, they're celebrities, they're also real people, and they could choose to maintain their privacy. But the fact that his family shared, it allows us to have an insight into his cause of death, or at least some complications that surrounded his death, so that we can learn. So again, he had a heart attack reportedly in 2019 and a stroke. And there actually is a connection, right? These are both considered to be cardiovascular diseases. We know that heart attacks are the cardiovascular disease, heart disease, the number one cause of death, period. And I am a kidney doctor, and people often say, oh, I heard this person's on dialysis and you die of kidney disease. Guess what? The number one cause of death among dialysis patients, heart disease. Number one cause of death among patients, on dialysis, chronic kidney disease. The number one cause of death is still heart disease. And so it's very important for us to talk about, and we'll talk about some of the risk factors and some of the modifiable risk factors, meaning the ones that you can actually change, right? And so that connection, having a heart attack oftentimes involves a blockage of a heart vessel, right? A coronary artery. And that can happen with atherosclerosis, right? A buildup of fat, cholesterol, calcium, platelets sticking together, right? And if they actually cause a blockage in an artery of your heart, a coronary artery, then it can stop that blood flow and cause the muscle of the heart to pass away. That's a heart attack. It's a death of cardiac muscle. Well, the same thing can happen in your brain, right? If you have atherosclerosis, a plaque, and it blocks one of the blood vessels that supplies your brain, the same thing can happen. You can have death of brain tissue, and that can cause you to have a stroke. Okay. Both of these things it's very important, because a stroke is actually the number one cause of long-term serious disability, right? And we know some of the symptoms of a stroke, and you can imagine what that disability looks like. But having a stroke is the number one cause of long-term disability. And again, a lot of the causes of strokes and heart attack are preventable. So first, let's talk about these symptoms, medheads. Let's see who behind the heart emoji shared what some of the symptoms are of strokes versus heart attack, and how would you know the difference? Anyone?
Hey, yes, Dr. Frita. Joyously hopeful. She says for stroke, slurred speech, or weakness. For heart attack, chest pain and arm pain.
Absolutely. Absolutely. So those both can be symptoms. And with the arm pain for a heart attack, the contrast with the stroke is that we're going to be talking about arm weakness, right? Arm weakness for a stroke, arm pain, usually left arm pain, but it can be both. Very good. Come on to the front.
Ms. Pauline, she says with the heart attack, blood flow to the heart mostly is blocked.
That's absolutely what happens in a heart attack. Okay.
Peggy, she says speech not understandable with a stroke.
Absolutely. So slurred speech or strange speech with a stroke. That's primary. Now, of course, if you're having a heart attack and it's affecting blood flow to your brain, something similar can happen, but it's more classic with strokes. Yes.
All right. VE says with a stroke, fast.
Fast.
The acronym FAST.
FAST. So we're talking about facial weakness, arm or leg weakness, slurred or strange speech. It's time to call 911. And we've actually added a BE to the front of that, be fast. If you have balance issues or eye trouble or blurry vision, plus facial weakness, arm or leg weakness, slurred speech, it's time to call 911. That is stroke. Very good. Yeah. Yeah. So y'all hit some of the main ones, the be fast for stroke. Any other ones you want to pop on there, Shador?
Yes, Miss Rosalind, she says for heart attack, the heart attack affects the heart, stroke affects the brain. Her brother both had both.
So you already know the connection. I'm sorry about your brother. So the same thing with Peabo Bryson, where he had a heart attack and then a few years later a stroke. There's a connection. So once you've had a heart attack, do know you're at very high risk for having another heart attack or from having a stroke. Vice versa. If you have a stroke, you're at a high risk for having a heart attack or another stroke. There is a connection. And again, we're going to talk about some of these risk factors and some things we can do to modify them. Sorry that happens to your brother. Very good.
Yeah. Yeah.
Okay.
And then Miss Sheila, she says, well, a heart attack affects breathing and chest pain and hit like a punch, and a stroke, the arm and face starts drooping.
Very good. So heart attack, we're mainly talking about chest pain. People will describe it as feeling like an elephant sitting on your chest. You can also get jaw numbness or pain, shoulder numbness, pain. You can get diaphoresis, meaning you're sweating a lot, like breaking out into a cold sweat. You can get shortness of breath. So all of those things are classic with heart attack. You can also have some atypical or unusual heart attack symptoms like nausea, vomiting, stomach pain. This happens largely with women and with diabetics. Okay. So there's different ways that it could present. Mainly though, you really do have an understanding of your body, what's the norm and what's not the norm. So if you're having these symptoms that are severe, that are persistent, please don't try to talk it away. Like, oh, maybe it's indigestion, or maybe, okay, my arm's weak, my face is weak. Maybe I slept funny. Maybe don't try to talk it away, because the time that you spend could be life or death. In fact, we have studies to show us that with stroke, for example, if you sit and you wait on those stroke symptoms, those BFAST symptoms, the patients who get to the emergency room within 3 hours have a much lower chance of long-term complications and disabilities when compared to those who wait longer than 3 hours. And then the permanent weakness, permanent speech deficits, permanent slurred speech, permanent eye changes, they become more permanent the longer that blood flow is blocked from the brain. So yeah, so right here on this YouTube channel, I'm telling y'all, I have just a myriad of information. I have videos on strokes explained. I have videos on heart attack symptoms. I have videos on how to unclog your arteries naturally. We know that high blood pressure is a risk factor. I have my book, Under Pressure, A Guide to Controlling High Blood Pressure, where I talk about how to manage that so you're not getting that bleeding brain stroke, because there's two types of stroke. There's an ischemic stroke, which is the most common, 87% of the time. And that's when you have a blockage of a blood vessel, so you don't get enough blood supply to a portion of the brain. And then you have hemorrhagic strokes, where blood vessels burst, largely due to high blood pressure. That's in about 13% of the cases. And so I have just about 1 million videos, it feels. So make sure after you finish watching this live, just go through, look at my various playlists right here on the Dr. Frita YouTube channel, and check out a video I did on Peabo Bryson where I talk about strokes. And that's I have a short on it here. Plus I have different little bits of extra information on my other social media platforms. And so please allow me to stress, follow me on all social media platforms. And y'all, because I definitely talk about the screw worms, and I'm going to talk about the screw worms here today. I know y'all are tripping on this screw worm. I definitely am. So yeah. So thank y'all for your participation on that. And we're going to keep moving this train right along. And we're about to play my favorite game, Myth versus Fact. And in this game, we're talking about throat cancer. Now, I know when I was growing up, when I heard about throat cancer, I automatically assumed that we were talking about cigarettes, right? Because we know that smoking tobacco cigarettes can put you at risk for head and neck cancer, for throat cancer. But there's actually a new bad guy in town. And this pathogen, this virus, is actually now responsible for most of the throat cancers. And so, Shadora, let's go ahead and play this clip about this wonderful actor, producer, director who is sharing his battle with throat cancer. And then we'll come back and do some myth versus facts.
When they were done with months of radiation, months of chemo, that's when it hit. That's when it was the hardest. That's when I felt like, whoa, am I going to get through this? I lost 65, 70 pounds. And it was hardest on my family, my kids who helped me. And they took care of me. And it was hard on them. My best friends who are they're here with me today. And they'd come over and be with me and sit around. And for them to sit there and look at me and talk to me and the way I was must have been scary. Because when I looked at myself in the mirror, I was scared.
Yeah. So that was actor Edward James Olmos talking about throat cancer. And so let's go ahead into these myth versus fact questions. So I'm really curious to see where you are, med heads, because a lot of people don't know about throat cancer as far as what the most common cause is and some ways to prevent it. So let's go ahead and do myth versus fact statement number 1, please.
All righty. HPV is now responsible for a significant and growing percentage of throat cancers, including in people who have never smoked or consumed alcohol.
M1 if this is a myth, F1 if this is a fact. All right, myth versus fact statement number 2.
If radiation therapy for throat cancer is successful, the throat tissue heals back to normal within a few weeks after treatment ends.
Okay, so y'all know that radiation is one of the treatments for throat cancer. What is this? I put an M2 if this is a myth, and F2 if this is a fact. All right. Whew, I'm telling you, we got everything going on over here. All right, med heads, what did you say? Let's go to myth versus fact statement number 1.
HPV is now responsible for a significant and growing percentage of throat cancers, including in people who have never smoked or consumed alcohol.
I'm curious, what'd y'all say, med heads?
All right, so KK says a fact.
A fact, okay.
Pearl says a fact.
A fact, okay.
The quiet threshold, aka Miss Elise,
Oh, Miss Elise, the quiet
says
threshold.
a fact.
All right.
Thomas says a myth.
A myth. Okay. All right. I like to mix it up, Thomas.
Miss VE also says a myth.
Hi, Miss VE. Day
Marilyn
1.
Boykins
All right.
says a myth as well.
Also a myth. Okay.
Members, Miss Sheila says a fact.
All right. Y'all better listen to Miss Sheila.
Miss
Okay.
Pauline says a fact.
All right, Miss Pauline. See back on the
Miss
fact
Rosalind
train.
says myth.
Ooh, we got a good mixed bag. Let me just read this for me again, please, Shador.
HPV is now responsible for a significant and growing percentage of throat cancers, including in people who have never smoked or consumed alcohol.
Oh, I'm glad we have a mixed bag because that means that this is a very important learning exercise. Because guess what, y'all? This is a fact. This is a fact. And as I was saying, you kind of think about throat cancer and those people who are chewing tobacco, or, having the carcinogens from smoking cigarettes. But now HPV, human papillomavirus, is actually responsible for most throat cancers. We're talking about the pharynx, the tonsils. Isn't that unbelievable? Well, it's true. It's true. And so HPV is a virus that's responsible for multiple cancers. So yes, the oral cancer that we're talking about, the throat cancer, and we've had different celebrities who've come and shared that they've had it. The actor Michael Douglas, y'all know him from a lot of things. My favorite movie that he's in is Fatal Attraction, but he shared that he had throat cancer related to HPV. And then the famous tennis player, now she and her wife are on Real Housewives of Miami, or they were on Real Housewives of Miami. Martina Navratilova had a bout with throat cancer, and her team shared that hers is from HPV. And so it's really more common than you think. And HPV, y'all listen, it's really everywhere. It's ubiquitous. Technically, it is an STI, sexually transmitted infection. But if you have it, or you've been told you have an abnormal pap smear, or you've had HPV, please don't go and try to hunt down your sexual partner. Don't try to beat them up, because the thing about HPV is that it's so quiet. It's so quiet that it's not one of these infections where you're getting all types of goop and discharge and smell and odor. No, most people don't know that they have it. Okay. And so they're not lying to you and, with you, and they didn't tell you. It's really just everywhere, just common. And so I just want to say that before anybody says, hey, I was told I had HPV. I didn't know it's STI. It's STI. Sorry, it is. So what happens with HPV in the cervix, right? For women, it can cause you to have abnormal cells in the cervix. And that cervix, when you think about the uterus, the womb, it's shaped like a pear, like an upside down pear. And at the very end of the uterus, right before it goes into the vagina, there's this little donut hole looking part of the anatomy, and it's the cervix. And right there is where you can get the HPV infection typically. And it'll start off as an abnormal pap smear. So if you've ever had an abnormal pap smear, there's a great chance that it could be related to HPV. And if it's not caught early enough, where you have elite procedure or colposcopy or something where they can remove those cancer cells, it can progress to cervical cancer, which is why we know that if you're able to prevent getting HPV, cervical cancer is one of the most preventable cancers. In fact, if you prevent HPV, that can prevent like over 90% of certain cancers, including oral cancer, cervical cancer. Men can get cancer on, it can cause penile cancers, okay? Cancer on the male genitalia. HPV can cause anal cancer in both men and women. And HPV can cause throat cancer, okay? Because if I'm telling you that it's an STI, right, sexually transmitted infection, if you are performing an act, okay, that involves fluid that might go to the back of your throat, I'm trying to be YouTube friendly, that's how you get HPV related oral cancer. That's just what it is, y'all, okay? This is an adult channel? I hope so. That's just the fact of it, okay? So basically, oral intimacy with someone who has HPV is what will cause the oral cancer, okay? And so that's what Edward James Olmos has shared. And so this is definitely a fact. Now, an overwhelming number of oral cancers are caused by HPV. Now, I want y'all little smarty pants, med heads, think y'all know everything. Tell me a good way to prevent HPV. Okay, don't put abstinence. Okay, yes, abstinence. If you had never had any type of a sexual contact ever in your life, okay, yes, you can prevent HPV that way. What's another way to prevent HPV infection? And then we'll move on to myth versus fact statement number 2. Anyone? I want to know who jumped out there, Shador. Anyone? Ooh, if no one answered, then that's more learning.
KK says condoms.
Okay, condoms. Okay, that is definitely one way that can help to prevent HPV.
Leslie may have the answer you're looking for, Dr. Frita.
Mm-hmm. But condoms is correct. It's one way.
Vaccines, get vaccinated.
Come right up here. Who said that?
Leslie, VE, Sandra.
Come on. There's room over here. The electricity might go on and off, but there's still room over here. Come on to the front of the class. Absolutely. The HPV vaccine. The HPV vaccine is something that is FDA approved, CDC approved, American Academy of Pediatrics recommends it, and it's recommended that children get the HPV vaccine starting at the ages 11 and 12. Could be earlier, but by the ages of 11 and 12. Because what the HPV vaccine does is that even if you are exposed to HPV, and again, I told y'all it's everywhere, it's ubiquitous. Most people don't even know they have it. Don't get mad at them. But if you're exposed to it and you've already had the vaccine before, hopefully, before you've had any sexual contact, like at 11 and 12, then your chances of getting any type of HPV-associated cancer, be it oral cancer, anal cancer, penile cancer, vulval cancer, vaginal cancer, cervical cancer, reduced by over 90%. Okay, and the vaccine is safe. Consult with your doctors, consult with your pediatrician. Also, and originally we had limited the age of when you could get it, but now even as late as 45 years of age, you can still get the HPV vaccine if you're a candidate. Okay, so that's the importance. So yes, that is a fact. The HPV is a huge cause of oral cancer. Y'all spread the word. And in addition to liking this video, share this video because this is something important for people to know and for mothers and for fathers, for parents, aunties, uncles to understand. Go look up, research the HPV vaccine. Full disclosure, I know my family gets tired of me talking about them, but all my kids have had the HPV vaccines and I can rest well because by the time they are out and moving in the streets, Lord, don't let them be in the streets that much. But by the time they're moving, I can rest well knowing that they have a greater than 90% chance of never getting cervical cancer, oral cancer, any of the other cancers from HPV. I'm just telling y'all. All right. Shall we do the versus back statement number 2? Why I done told all my kids' business again?
Yeah, let's move on. All right. If radiation therapy for
Oh, I didn't hear you. Oh, is that me cutting off? Hold on. Avery, come here.
throat cancer is successful. Frita, guys.
Okay. Now, I didn't hear you for part of that. I hope everyone else did. And that could be
okay, they did. Can you hear me?
I hear you now.
Okay, yes. I'll repeat it. All right. If radiation therapy for throat cancer is successful, the throat tissue heals back to normal within a few weeks after treatment ends. All right.
Okay. Let me see what you say.
Miss Katrina.
One I don't think is well known. Okay, go ahead.
Miss Katrina says myth.
Okay.
Me just saying says a myth.
Okay.
Member Miss Pauline says a myth as well. Miss Sheila says a fact. Wind Sprinter says it's a fact.
Okay.
Open Heart says myth.
Open heart. I love that. Okay.
Antonio says a myth.
Hi, Antonio. Okay.
Nick Nack, hey, says a myth.
Patty Whack. Welcome back. Okay.
Ms. Rosemary, member, hello, says it is a myth as well.
Okay.
Joyceley Hopeful says a fact.
All right.
And what you know, Joe says a fact.
What you know, Joe? You know, two of my uncles' names are Joe. I got Uncle Joe Holt. I got me an Uncle Joe Randall. What you know, Joe? Okay, I love the name Joe. All right. So we got a mixed bag, and I'm glad we did because this is actually a myth. It's a myth. And this is what the actor Edward James Olmos was alluding to, how he lost, like 60 pounds? So yes, radiation is a treatment, and it is meant to destroy cancer cells. But the major side effect, y'all, is that it can also destroy normal tissue around the cancer cells, right? So it can destroy cancer, the tissue that's responsible for swallowing. It can affect your tonsils, your uvula. You know, in those cartoons, that little tissue that dangles when they close in on the cartoon screaming, in the back of your throat is screaming, your uvula. So it can damage that. It can damage, part of your swallowing, your pharynx, like the beginning of your esophagus. It can damage just so many things. And for many patients, it's even once the radiation is over, 6 to 12 weeks after, they're still dealing with the inflammation, the pain, and oftentimes they can't eat. Oftentimes they're not able to speak well. Okay. It affects their speech. And in his case, where he lost like 60 pounds, I believe he shared, it is really debilitating. And so the radiation and the treatment, boom, that's not the end of it. You can suffer long-term or sadly even permanent side effects. And that's why, with cancer treatments, be it chemotherapy, radiation, it's so tough. It's so tough because yes, we have, we do the best that we can with technology and medicine, but the best thing, of course, is prevention. Prevention is key when we're able to. So yeah, the radiation is not the end of the treatment. It can last and last and last. All right. So thank y'all as always, and everybody who came to the front of the class. Let's keep moving because we have to get to the screwworm story. I promise you, we're getting to the screwworm story because y'all know we have this flesh-eating parasite that is here in the United States. It's the first time it's been here since 1966. Okay. And I had an update. I did a short form content on it. I did a reel over the weekend because we had an update that did not make me happy. It won't make you happy either. But we're going to talk about these screwworms because you need to know. But first, let's get into our second weekly dose of the latest trending medical headlines and celebrity health news because we're going to talk about Karamo. Y'all know Karamo from Queer Eye. He has been, he's really huge. He's been an author, certainly a talk show host. He's on Queer Eye. He's very outspoken, pretty neat guy, certainly a great storyteller. And now he has shared a story of botched plastic surgery. He had buccal fat removal. And before we even get started, I want y'all to tell me, give me a picture of, I don't even know what to tell y'all to give me a picture of. Child, just give me a picture of a star, okay? Because Karamo is a star. And this affects a lot of stars and celebrities. But give me a picture of a star, an emoji, and tell me, before Karamo shared his story, before me sharing this with you, had you ever heard of buccal fat removal as plastic surgery? Had you ever heard of buccal fat removal as plastic surgery? And let's go from there and let's hear Karamo's story, and I'll come back and I'll tell you more about it.
Yeah, Dr. Frita, I don't have the story on that. Remember, we talked about that.
Okay, yeah. So we'll just go ahead and jump in and then talk about it, and I'll see what y'all said about it. Okay, so I'll tell you what buccal fat removal is. So if you have a round face, like someone on this current live may or may not have, then you might be self-conscious about it. Okay, you may feel like it makes you look, too chubby. And most people, when they have round faces, as they get older, those faces, they'll lose the quote unquote baby fat, and that buccal fat will go down. But as Karamo shared, he, especially like around COVID, he had gained a lot of weight. People who are rude were commenting on how much weight he gained and how kind of fat he'd gotten. And yes, they were using that word. And so he was feeling self-conscious about how chubby his face was looking. And so he went to the plastic surgeon to have some of the fat in this hollow part of your cheeks to have that removed. And so when plastic surgeons remove the buccal fat, they're able to do it. And, a good plastic surgeon can do it without leaving any kind of a scar. And what they do is they can go inside of the mouth, and where this fat is in this portion of your face where I'm pointing to, kind of under the cheekbones, they're able to suck it out. And for some people, that's the aesthetic look they're going for, because it can help your cheekbones look more chiseled, right? Like if I didn't have any buccal fat, y'all like that? I might look like that, where the fat goes in and it makes your cheekbones look more defined. And they might feel like it gives them a more chiseled look. Like a man might not want a nice little round, soft baby face or chubby cheeks. He might want a more chiseled look, And so taking out that buccal fat, that cheek fat, can make your jawline more prominent, your cheekbones more prominent. And, this is the kind of look that Karamo was going for. Okay, sounds benign enough. It's a quick procedure, same day procedure. But here's what happened. He had a complication. He had some scarring. And do you know what else is in your cheeks other than just a little fat? Your salivary glands, right? The openings for your salivary glands, helping you to digest food. The salivary glands, which put out certain digestive fluids. Well, due to his scar tissue and inflammation, his salivary glands were blocked. And so in that photo that you see, Ishador, if you put that up again, where he has that swelling, literally the salivary juice, his saliva, was getting blocked in his cheek. And so this is how he was looking after the procedure. It was due to a botched, or I'll say a complication from his buccal fat removal. He had scar tissue, and now his salivary glands could no longer release. And so while he was going to do a non-life or death procedure, but something for, him to feel good about himself, for self-esteem, for how he presents to the world in media, which he does, then it ended up with a complication, which of course was much less aesthetically pleasing than his chubby cheeks were in the first place. And so now he's coming forward and he's talking about it because he was able to find a surgeon to correct it. And you see now his face looks very nice, very symmetrical. But buccal fat is not something that we talk about much. We always talk about the BBLs and breast augmentation and this and that. Or even when you think about facial procedures, there's a lot of, fillers, Botox, things of that nature. But buccal fat procedures, even reportedly Chrissy Teigen talked about having that done. But here's something else. When you're young and you have, the buccal fat, and maybe you want a more chiseled, model-esque looking face or something like that, imagine if you're in your 20s and your 30s and you get it done. But what happens by the time you hit your 50s and 60s? Y'all know what happens. You start to lose fat in your face, right? And your face might become gaunt. And so it really is important for plastic surgeons to talk to young people who are going and getting procedures done, like fat removed from the face. Talk to them about what's going to happen as they age, 20 years, 30 years. Is having the buccal fat removal going to make you look more gaunt and more aged? It's a very real possibility. But that's just one of the things, Karamo, came forth and was sharing his story. And so I'm curious, have any of y'all heard about this buccal fat procedure before he shared? And what do you think about that? What do you think about these plastic surgeons,
Hey, Dr. Frita. Yeah, a majority of people saying no. Joe have not heard about it. Joyously Hopeful has not. Wind Sprinter has not. I thought someone said yes, they heard of it.
I would have
before.
anyone heard of it.
Not saying that there. While I'm looking for that. The Quiet Threshold has heard of it.
You have heard of it.
Yeah.
Okay. Yeah, it's not something, and even as a physician, I only started hearing about it from certain people I've seen on Instagram. And, and this one man wanted to have a really chiseled, model-esque look. And I'll tell you, what plastic surgeons typically require or recommend is that if you're going to get the buccal fat surgery, that you're already at a balanced weight, like you're not in a big fluctuating weight. They recommend that, and that your weight is at a steady state. You're at a weight where you're going to stay and not be going up and down. That's one of the things. And also that they don't recommend it in someone who already has a relatively gaunt face, a long face that is relatively long as far as length to width ratio. If you already have a face that's relatively gaunt, they don't recommend you going in and removing the buccal fat to be more chiseled, because again, being responsible in evaluating and recommending, it is important that they tell you that by the time you're 50 or 60, that face might start to sink in on its own. And the buccal fat, the chubby cheeks that you don't like now, might actually help you to look more youthful as you get older. So those are all very important conversations to have. Yeah.
Yep.
Anyone
Dr. Frita,
else?
shout out super chat, Miss Sheila.
Oh, super.
For the
Oh,
super
thank you,
chat.
Miss Sheila. Oh, I appreciate that. I appreciate the super chat. And I appreciate all of you all for being here and members who are in here doing that extra. You know, we had our live Q&A last week. I'm going to definitely get on and give y'all, so much has been going on behind the scenes. I'm definitely going to share some more with you because, I was on Don Lemon on Friday, okay, talking more about President Trump after he had his third annual physical exam in 13 months, because now it's been revealed that he's actually taking a medication that they didn't share on the list. So the team's dishonesty about his medications came out. He's on something called Propecia or finasteride. It's a medication for hair loss, but he didn't share it. And when confronted, his team said, he's not required to tell y'all every single medicine he's taking. And that's probably true, but then it makes you question, how honest is he being in general about his health? We know that they're not being honest about him falling asleep, because Secretary Marco Rubio sat there on a hearing under oath and he said, I've never seen the president fall asleep. They say he's just blinking. But y'all, listen, go on my short form contents. I have shorts on YouTube. I have shorts on my other social media platforms where I actually talk about sleeping, daytime somnolence, and very seriously, I talk about the serious causes of daytime somnolence, like some real disorders that can cause it. And I talk about very serious, potentially life-threatening complications of daytime somnolence. And by daytime somnolence, I mean sleeping during the day, which is what we see him doing. Plus, we have, many journalists who have recorded him sleeping during the day. So it's actually not a joke. It's actually very real. So check it out, because if you know someone who falls asleep a lot during the day, it could affect them. So make sure that after you finish watching this live, you check out my daytime somnolence explained. That's on my social media platforms and short form content. All right. Yeah. Make sure y'all give us a like here. And we're going to keep moving. I got one more story before we talk about screwworms. And yes, we're going to talk about the New World screwworm. But just also, make sure you save my one-stop shop, drfrita.com, because there you will be able to, if you enjoy these conversations, evidence-based medicine, but you want to talk to me one-on-one, I do offer a telehealth concierge service. And I'm telling you, we talk about, of course, serious topics in medicine, but I just enjoy reaching out to patients literally all over the world, one-on-one, where I can talk to you about your health, your labs. I do a full history. I can, give you my input on what your doctors are doing for you, just, based on what I shared, how I have been board certified in internal medicine, nephrology, pediatrics, obesity medicine. I have a lot of very real knowledge, and I read medical journals. I stay up to date on studies every day. No exaggeration. It is my love. It is my love to study medicine. It is my greater love to share. And so if you're just sitting here and you're like, dang, I wonder if everything's being done for my high blood pressure or my kidney disease or my weight loss journey, or, or you're wondering, about your person you're taking care of, then make sure click the link in the description or go to my one-stop shop, drfrita.com. And then also, if you're someone who's on the go and you enjoy a good podcast, we do have our podcast, Healthy Happy Life with Dr. Frita, where you can listen to us while you do other things. You fold your clothes, while you walk the dog, while you walk it out, while you do whatever you do. But we do have that on everywhere where you listen to podcasts. And I do ask this of you, once you go there to the podcast, please give us a 5-star rating. It actually means quite a bit to us. And I already mentioned my book, Under Pressure, A Guide to Controlling High Blood Pressure, where I continue to have new and exciting things going on with that I'll keep telling you about. But that's where I talk about managing blood pressure, not just medicine. And of course, I am trained with traditional medicine, but also I talk about natural holistic measures that can help to lower blood pressure. I covered that, and it's a nice 360 all around view, Under Pressure, A Guide to Controlling High Blood Pressure. All right. So let's talk about one more thing before we get to the screwworms. Screwworms. Who came up with that name? Oh, no. I'll figure that out later. All right. President Joe Biden. Now, we know that even though he's trying to relax and he's retired from his position as president, we know that the administration can't keep him out of his mouth. Anytime someone is at a Senate hearing, there's like, well, Joe Biden did this, well, Joe Biden did that. And we're like, okay, we're trying to talk about what's going on right now. But anyway, Dr. Jill Biden, our former first lady, the wife of President Joe Biden, has been on a tour, and she actually started talking a bit about her husband. Okay. So let's watch this clip and see what First Lady Dr. Jill Biden said about her husband as far as his prostate cancer.
How's Joe doing? We all love him here.
You know, he's doing okay. As probably everyone in this
audience knows, because I'm sure you've all been touched by cancer. It's hard. It's hard. You know, it's stage 4. It's in his bones. But he's keeping up his schedule. He's going to DC on Amtrak. What else?
Yes.
A couple times a month. He's speaking at Democratic rallies. He's writing. So he's active. He's Joe.
Yeah.
He's Joe. Exactly. Well, I think when so many of us heard about this diagnosis, we're wondering how the president of the United States, who has access to the best medical care in the world, arguably, never missed an annual physical. He never did.
That's right.
How could such an aggressive cancer go undetected? And you write about how you had been concerned about him. You had even alerted his medical team about the concerns. Was there a time when you said to the president, Joe, I need you to slow down, even though you're Joe?
First of all, we had an amazing medical team. I mean, I had my medical team, he had his, and we did get annual physicals, and but they followed the guidelines of the American Urology Association, and which says that men don't get prostate screening after the age of 70. So unfortunately, they didn't do the PSA.
I love that Dr. Jill Biden is sharing this story. I love that she's sharing this story. And so I'm going to talk to you all about prostate cancer. But first, let me ask this question. And I want you to give me, what do I want y'all to give me? Just give me a blue heart. Give me a blue heart in the chat and answer this for me, please. Because we're going to talk about all men. We're going to talk about President Joe Biden. But I'm just curious to know, did you know this? Did you know that Black men are at a considerably higher risk of passing away from prostate cancer when compared to other ethnic groups? And do you possibly think, or do you realize that what is stated as far as screening recommendations for prostate cancer for general men, that Black men might need something different? So basically, did you know that Black men have a significantly higher risk of passing away from prostate cancer when compared to other ethnic groups? Did you know that? Yes or no? Did you know that Black men could be more affected? All right. So let's talk about prostate cancer. So what Dr. Jill Biden is talking about, of course, is that President Biden was diagnosed with prostate cancer, stage 4, meaning it had already spread. It spread to other organs, and for him, it spread to his bones. We know that prostate cancer is the most commonly diagnosed cancer among all men, okay, including Black men, of course. It's most commonly diagnosed cancer. And then when you talk about Black men in particular, Black men tend to be diagnosed with more aggressive stages of prostate cancer at younger ages. And also, listen to this, Black men are almost twice as likely to pass away from prostate cancer when compared to white men. Okay, so those are the statistics for Black men, but then with all men still, prostate cancer is the most commonly diagnosed cancer outside of skin cancer. Skin cancer kind of across the board is most common. And so what Dr. Jill Biden is talking about is true as far as the recommendations. For a lot of these recommendations, they say that by the time you're over 70, then perhaps you don't need mammograms as often or at all. Perhaps you don't need colonoscopies as often at all. And then as far as the American Urological Society, if you're over 70, let's just stop doing PSAs. Well, the problem with that is just because you're over 70, that doesn't mean that you're going to pass away by 72, 73, 75, 80. And as you can see in the case of President Biden, he's still alive and well, minus his prostate cancer. And so had he been screened, had he had the PSA, even over the age of 70, then very likely they would have picked up on a high PSA. And when I say PSA, I'm talking about the prostate specific antigen. That is the blood test that if it is elevated, especially if it's over 4.0, then it could mean that you have prostate cancer. Here's the trick. It can mean other things as well. A high PSA could just mean that you have some inflammation, like prostatitis, some inflammation. And so there are often a lot of false positives, okay, where you get a high PSA and you don't have prostate cancer, which is why there's been so much conversation and, quite frankly, controversy over the different medical societies on when to screen and when to not screen. And so, of course, there's an individual discussion to have with physicians and have shared decision making. But now let me just talk to people who are at high risk. Okay. You're considered to be at high risk, certainly point blank, period, if you're a Black man. Okay. If you're a man of African descent, there's no such thing as you being at low risk, just based on the numbers and just how commonly Black men get prostate cancer. So understand that you're not at low risk if you are a Black man or a man of African descent. Okay. Period. And then if you are someone who has a family history, like if you have a first degree relative who's been diagnosed with prostate cancer, it's like a father or a brother who's been diagnosed, then you also are not at low risk. And so it is recommended to have the conversation for high risk and very high risk people no later than the age of 40. And then based on some of these societies, they say 45, they say by age 50. Talk to your doctors, but just based on the numbers, I recommend, and this is the Dr. Frita, Society of Dr. Frita, that you definitely all Black men, but I recommend that all men at least have the conversation by the time you're 40 years old. Okay, have the conversation. And should you have the PSA done, again, it's a shared decision-making process with your doctor. I personally recommend it to my patients, okay, to go ahead and get the PSA so that you can have the trend. Now, does that mean sometimes you're getting tests and you're getting biopsied and you end up not having prostate cancer? Yes. And when that happens, we say, yay, we're so happy. Because I'll be honest, what happens a lot of times is if you're getting a lot of false positives and then a lot of tests, biopsies, ultrasounds, what does that do? That costs insurance companies more money, right? And so then there's a certain motivation, a monetary motivation to cut back on some of the screening, right? And that's just the honest truth. But I'll tell you what I recommend to my patients, at least by the age of 40, have the discussion of being screened. And if you're a Black man, go ahead and get screened by the time you're 40. And if you have a family member, say, who's been diagnosed at 39, Funky Dineve, I mentioned him. Y'all know I've been on his show a few times talking about different topics, and he is going through his journey now. He was diagnosed at the age of 41 with prostate cancer, right? And so he had his surgery. Unfortunately, his was caught at a very early stage. It had not spread, and he appears to be doing well. He, Funky Dineva, but he shared that his father was diagnosed with prostate cancer at 39. And so if you have a family member who's diagnosed with the cancer, then I would recommend that you talk to your doctor, let them know that, because many medical societies recommend that you start getting screened 10 years before your first degree relative, like your father, your brother, was diagnosed, which in Funky Dineva's case would have been, being screened by the age of 29, perhaps, or maybe since prostate cancer is so slow growing, they might have told him 35 but at least you have the conversation. And so I say this to say, because ageism actually does exist in medicine. And how do I know? Because I have a lot of patients whose kidneys fail and they're in their 80s. Well, they might be a super healthy 80, active 80, and 80 with a good mind. And sometimes their primary care doctor will be like, oh, you're 80, you're too old for a transplant, you're too old for dialysis. And I'll be like, come again? Because I've dialyzed patients in their 90s. Yes, I have. It's an individual decision and a shared decision. But if it's someone who has a good quality of life, if they are able to largely care for themselves, if they still have life to live where they're enjoying being here and they're healthy enough to have the dialysis without having some heart arrhythmia, then why not, right? If they're healthy enough to have the kidney transplant without the surgery and anesthesia being a huge risk to them, then why not? My point is this: please don't allow people to tell you that your age in and of itself is the only thing to keep you from getting potential life-saving or preventive health services. Have that conversation as an individual. And so I like Jill's story. All right, we're about to talk about screwworms. Did anybody mention the prostate cancer that they already knew about? Black men almost twice as likely to pass away from prostate cancer when compared to other men, to white men specifically.
Yes, Dr. Free, the majority are saying yes, they knew about it.
Yeah. Y'all
Yes,
men
ma'am.
heads. Oh, I love y'all. Y'all think y'all pretty smart. You are. All right. Y'all ready to talk about screwworms?
Yes.
I really don't want to talk about screwworms, but the screwworm is here, and that is the name. It's the New World screwworm. Okay. And I'm going to talk to y'all about it, because what happened, we've known that these screwworms, these are flesh-eating parasites. They're actually flies. Okay. And the flies will lay eggs. The female fly will lay her eggs on warm-blooded mammals, okay? Living warm-blooded mammals like cows, like horses, like humans. And her eggs, she'll lay them, and then and if they're in a nice open wound, or if there's some broken skin or mucous membranes like the nose, your eyes, your ears, then these eggs will hatch, and then the larvae will burrow into the living flesh, okay? Because these aren't like typical maggots. Typically, flies lay eggs and they have maggots, and these maggots like to feed on carcasses, right? On deceased bodies. But the screw worms feed off of living, warm-blooded animals, okay? And when they do that, the living animal isn't living for very long, because after they finish burrowing into all of the organs, then that animal, unless the animal is treated, passes away. And then, of course, if you're dealing with the screw worms and they're on cows, on cattle, then of course that ruins the beef. And that's where this story becomes significant. We've known about screw worms in Central America, and over the last couple of years, they've been moving up further north. They've been in Mexico, but guess what, honey? As of this past week, the screw worm has entered the building. It's now in the United States, and this is our first screw worm since 1966. This screw worm was found in La Pryor, Texas, which is about 30 miles northeast of the Mexican border. Okay, one screw worm. It was found on a little baby cow, a little calf, 3 weeks old, on the belly button region, right? The umbilicus. Okay, that was that. And so now we started taking measures, which I'll talk about. But guess what? Just a little tiny bit after that first screw worm was found, over the weekend, they found another screw worm. And the screw worm that they found was 5.6 miles away from the original screw worm. What does that tell you? If you found two, there are probably more, right? And so they had already set up this perimeter, like with anyone or any cow, herd, cattle within a 12.4 mile radius of La Pryor, Texas, they were doing detection and quarantining, which presumably is how they found the second screw worm case. But it sounds like with all these screw worms, there's probably and likely more. And if there's a high screw worm infestation, it can really devastate the cattle industry, make beef prices go up sky high. It can affect dairy. And already Canada over the weekend was like, they're not accepting any horses or any cows from the United States. They have blocked it. Okay. And so already that's affecting our money. And again, the screw worms were detected in Texas. Texas makes like 15% of our beef. They're the largest state with beef production. So let's go ahead. Let's watch this video. We have a video, Shador, and then we're going to talk a little bit more about screw worms, honey. And if y'all have any questions on screw worms, put them in the chat. I'll answer a few questions before we slide out.
This morning, concern among cattle farmers now that a case of New World screwworm has been detected in the U.S. The Agriculture Department confirming a calf in South Texas is infected with the parasitic fly, which can kill livestock if not treated.
This pest does not cause any sort of a food safety issue. It is not a disease, but simply an insect that feeds on living tissues. Animals treated early enough will recover and are safe to enter the food supply system.
The news comes just days after Secretary Rollins dismissed a local lawmaker's warning that screwworm was detected in Mexico, just a mile from the U.S. border.
The screwworms are very aggressive. They kind of hook themselves into live tissue, and it can be very, very destructive.
The parasitic flies were eradicated from the U.S. back in the 1960s. A human case was confirmed in an international traveler last year. That person recovered.
This is something that sounds very scary, but the threat to humans, especially people in the United States, is very, very low at this time. People who are at a higher risk are individuals who hang around livestock.
But one major concern is the beef industry, which is already struggling. Beef prices are up 13% in the last year. One factor? Fewer cattle. The U.S. cattle herd is at a 75-year low because of extreme weather, high feed costs, and industry consolidation. The screwworm could make matters worse.
Since cattle are much bigger and much slower to reproduce, it takes many years to fix the problem.
All right. Let me ask you all this, and please give me a cow. Give me a cow emoji. Hearing this screwworm story, does that make you realize a little more the connection between agricultural health and human health? And does hearing this story change the way you're going to eat? Are you going to eat less beef, or are you going to go ahead and trust that beef that's inspected properly is going to be fine as far as screwworms are concerned? So tell me that. And if y'all have any screwworm questions, that sounds crazy. If you have any screwworm questions, go ahead and put them in the chat as well. Okay. Meanwhile, I'll tell you a little bit more about the screwworms. I mentioned that, the female will lay her eggs specifically on living warm mammals. And yes, the risk to humans is low. As you heard, there has been a documented human case in a traveler. And if you are someone just kind of, outside of what we think about in the typical United States standards, what if you're someone who lives outside, if you're someone who's unhoused, if you don't have a home and you're immunocompromised and you have wounds, okay, like if you have poor circulation and you have some venous insufficiency wounds, or if you're a diabetic and you have some wounds on your feet and you are out and about where flies are, and if you're in Texas, La Pryor, Texas, then if you're immunocompromised and you have open wounds, then yes, a screwworm really could cause an infestation in your wound. And it would be tricky because most doctors aren't used to seeing wounds that are infested with screwworms. They might be looking at a wound and not quite knowing what the problem is. But if they see little like kind of white shining little holes, like burrow holes, then that's what the little larvae might look white or shiny, and they might have little burrows in the wound. And so that's something for your doctors to look out for. So it's very rare. Okay, human risk is low, but I just want to make sure that I'm not gaslighting you. It is possible, okay, for humans, but mainly we're talking about livestock. We're talking about horses. We're talking about cows, who are at most the highest risk. But again, the female will lay her eggs on the wounds, and they can go in the nose, the eyes, the ears, anywhere where there's a wound. And they love, being in the umbilical region, where they can get to the blood that way. And the screwworms will feed on this living warm-blooded animal for about 7 days. Then the screwworms drop to the ground and they emerge as flies, screwworm flies, so they can go off and complete their little parasitic ways. And there are a few ways that we can prevent them. So yeah, animals can be treated. You literally kind of go and you pick out the screwworms, but again, oftentimes the beef is ruined. And someone asked me on one of my short form contents, I did post a couple of screwworm videos over the weekend. They asked, if you cook beef, can you kill the screwworm? The answer is yes. If it's cooked to 165 degrees Fahrenheit, then the parasite, the larvae, will be killed. Not that you want to even eat a deceased screwworm, but if you happen to swallow a screwworm larva and it's living and you swallow it, then your gastric acid will kill it. Your stomach acid will kill it. And so you're not at a high risk. That was what I'm saying. If you eat beef or any kind of a meat that has a screwworm in it. I know you don't want to do it, and I know your stomach is probably turning with the conversation, but these are just some of the facts to make sure I'm not fear-mongering here, but I'm keeping things evidence-based. And then I'm going to tell y'all, before we close, how they actually prevent screwworm infestations, how they get the screwworm population down. But first, Shadori, any questions? Have any questions popped up?
Yes, that's actually one of the questions. What provisions are being taken to keep them from spreading all over the USA?
I'm glad. Who asked this?
This is from Latasha.
Hi, Latasha. You're reading my mind. I'm glad you asked. So the first thing, as I mentioned, they set up this perimeter of quarantine. If you are within a 12.4 mile radius of La Pryor, Texas, which is where they found it, then your horses, your cattle, they're not able to move. You can't ship them out. You can't put them on a truck and drive anywhere. You're stuck there. And they're doing quarantining, and they're doing a detection that way, which is probably, again, how they saw that second one. So that's one thing. But here's a really neat thing, Latasha, and this is why I love science. They are releasing sterilized male screwworms, which are the flies, into the society. And let me tell you what that means. So they basically irradiate these male flies, screwworm flies, to make it so that they're sterile, they're infertile, okay? And so even if they mate, these sterile screwworms, if they mate with a female screwworm fly, then the eggs that she lays won't be viable. They won't live. And so what scientists do is they release millions of screwworms, male screwworms, into the area of infestation. And by them releasing millions, they outcompete with the wild male screwworm flies, which actually are fertile. And so imagine if you have a 10-to-1 ratio, mostly sterile flies versus the one little fly that is fertile, then more likely than not, the sterile flies will be able to outcompete and get to those fertile females and mate with them, right? Because the way they do it, they make the flies sterile, but they still make it so that they are aggressive in their mating. Okay. It's really wild. So then now they release these millions of sterile flies and they go around and they mate with all the female screwworm flies. And so these female screwworm flies now will lay their eggs. Their eggs are unviable. Their eggs don't hatch. Their eggs can't have these flesh-eating parasites. And here's what's super significant about that, because you might be thinking, oh, well, the female mates with, one sterile male, but what if happens when she goes and mates with someone else? She can't. She won't. Female screwworms can only mate once. So once we release these sterile screwworm males and these males go and compete and they mate with a female, her reproduction is over. And that's how we cut back on the screwworm population. And that's what's being done. That's a major, major intervention. Isn't that neat? Tell me if y'all think that's neat. Am I a nerd? Okay, I'm a maybe, plus or minus. We'll agree to disagree. But y'all can't tell me that's not neat. Like, who sits around thinking about making flies sterile to go out in millions of them so they outcompete the sterile ones? That's crazy town. I love it. All right. Any more questions, y'all? Y'all, please make sure you give us a live. I appreciate y'all for hanging in with us and for being so interactive, for asking questions, for giving feedback. That's what makes this fun, and that's what makes us able to learn. So again, thank you for making the Dr. Frita channel now have over 1 million subscribers. Be sure you check out my playlist where I talk about television appearances. I was just on the Don Lemon Show again last week. I told you News Nation before that, Joy Reid Show, Channel 2, Action News. I do different things just to let y'all know what I'm doing in the media streets. And to all my members, I'm gonna get some more members only videos for you. And so as always, appreciate y'all for the extra help and for the super chat as well that we got. Thank you. All right. Any more questions as we get ready to slide?
Yeah, I do have one question, Dr. Frita. A lot of people say it will change how they will consume beef. They may eat less beef.
Okay.
So the quiet threshold asks, are you going to continue to eat beef, Dr. Frita and Shador? So myself, I'm not a big beef eater anyway. I maybe consume it once every few months. So Dr. Frita, does that change how you?
I'll say this, it doesn't change what I was doing with beef. It doesn't change because at least as of now, hope this doesn't change. I do have a certain faith in the inspection of USDA and the fact that they did go and they found that second screwworm right away. That also makes me feel like, that the inspection is being taken seriously. I will say that there's been some controversy and some folks criticizing, saying that we've known about these screwworms really since 2023 when they started moving north from Central America to Mexico. And, some criticism is that we should have been releasing those sterile screwworms even south of our border. Kind of, it gets back to that whole containment thing, right? Containing infestations and illnesses before they get here, and there's been some criticism saying that with all the changes in the current administration, maybe this wouldn't have happened. Perhaps, but now I feel like we are on the job. We're doing what we're supposed to do. And so this does not change the way that I was eating beef before. Yeah. I'll let you know if it does. And if I come up on here and I tell y'all I'm a vegan, something happened. All right. Well, thank y'all med heads, very, very much for being with us. And, hopefully you were able to learn some things from everything that we talked about. We talked about Ebola, they gave you the updates there. We talked about Peabo Bryson, heart disease and strokes. And again, I have many videos here on my YouTube channel, so make sure you check those out on heart disease and strokes. Once you finish this, we talked about throat cancer. And I know I surprised some of you with the HPV. Talk to your doctors about HPV vaccine. Go ahead, run it. Look at what I told you. I'm telling you, it's the real deal. It's actually preventable. HPV can prevent cancer over 90% of the time. We talked about President Biden, still in the news, still on everybody's lips, but about prostate cancer screening and really making sure you also use your own intuition when you have your shared decision making with your doctors and getting the PSA. We talked about those things, and we talked about Queer Eye star Karamo. And I think I surprised a lot of you with the plastic surgery of buccal fat. Again, always go to a board certified plastic surgeon and, do what you need to do or feel you need to do to have your good self-esteem and to feel good about yourself. Always weigh the pros and the cons. Go see board certified plastic surgeons. Appreciate y'all for being here. Make sure you give us a subscribe and a follow, and that way you'll all subscribe and hit the notification bell. That way you'll know that when we're here and we're giving evidence-based medical information. Follow me on drfrita.com. That's my one-stop shop, and you can see my favorite things. You can also download my PDF. I give y'all some free stuff beyond information. Download my PDF on 10 healthy habits for a better you and a better life. We'll put that in the description. You can also go to drfrita.com. And this is the guide that I use in my everyday life, child, to try to be healthy and to try to be happy. But again, I appreciate y'all for being here on Dr. Frita Live, where we discuss the latest trending medical headlines and celebrity health news. We'll see you next Monday. Same bad time, same bad place. And as always, I thank you for making Monday your healthiest day of the week.